I now have the real pleasure and honor of introducing our keynote speaker for this commencement. Over the past 2 decades, our speaker's actions have spoken volumes about the singular role of public health practitioners on the front lines of fighting some of society's gravest ills. The issues of substance abuse, HIV/AIDS transmission, and homelessness are among the hardest puzzles for any practitioner. She has said that she always subscribes to the idea that you can judge the greatness of a nation by how it treats its weakest members, an astute observation about society stretching back millennia to Aristotle. It is one thing to say or write these words, and it is another to actually live by them. Our speaker, Dr. Monica Bharel, has made the betterment of the less fortunate her life's work. First, as a medical practitioner in a variety of urban settings, then as the medical director of Boston Healthcare for the Homeless, and now as the commissioner of the Massachusetts Department of Public Health. At the Boston University School of Public Health, we see ourselves as leading the effort to improve the health of the public now and into the future by generating ideas, teaching those ideas to the next generation, and translating them for people who can make change happen on a global scale. Dr. Bharel is at the forefront of those who can make change happen, and it is really our distinct pleasure to be her colleagues. Graduates and guests, it is my honor to call on Dr. Monica Bharel to give the keynote speech of this year's MPH Commencement.
Good afternoon. Thank you, Dean Galea, and thank you to the BU School of Public Health for having me here today. The energy in this room is infectious, and there's nowhere else I'd want to be right now. It's an honor to be here with such an esteemed group of faculty, students, family, and friends. To the students, I'm humbled to be here because you truly represent the next generation of public health leaders, scholars, thinkers, and dreamers. Graduation represents an important achievement, a moment of celebration. And in that moment, inspirational and heartfelt words are shared in a hope to inspire an even better generation, capable of building a better world. But graduations also embody an important statistic. Educational attainment, one of the most powerful social determinants of health, predicts a person's lifetime of health, well-being, and productivity. By being here at this graduation today, you will, in fact, if the statistics don't lie, on average live longer, healthier, and more productive lives. The simple fact is, the social circumstances in which we grow, work, play, matter. Today, I want you to remember one thing: zip codes and place matter. Nothing illustrates this better than some data that Dean Galea shared with me earlier this year from right here in Boston. The Dudley Square train stop is only 2 miles away from the Arlington T-stop. However, families who use the Dudley Square T-stop are 8 times more likely to live below the poverty line than those who use the Arlington stop. How does the place and this zip code-driven social determinant of poverty correlate to health? Well, according to the same data, 3% of adults who use the Arlington stop have diabetes, and that rate is nearly 4 times as high, just 2 miles away in Dudley Square. And then the ultimate measure, the premature death rate of individuals getting off at the Dudley stop is over twice as high as those using the Arlington stop, 2 miles. These numbers don't reflect a proximity to care. Healthcare facilities are located just as close to Dudley Square as they are to Arlington. This is about something else, something that is much deeper and much more disturbing. Today, I hope to share a story, my story, and in doing so, light a torch within you who are motivated by a relentless passion for seeking equity. I hope for all of you that you will find careers that are motivated by building a world where all people have the opportunity to achieve, regardless of where they live. To that end, I want to take some time today to lay out a vision from the roadside to the patient's bedside to the halls of bureaucracy, to the role I see public health playing in our world today, and offer 3 pieces of friendly advice from my own experiences. I've spent 20 years working at the crossroads of medicine and public health in urban settings and with vulnerable populations. Today, I'm privileged to serve as the Commissioner for the Massachusetts Department of Public Health. Having spent many days and sleepless nights working in hospitals across Boston and Massachusetts, and now with a bird's eye view from the Department of Public Health, I'm a strong believer that this city and this state represent the greatest place in the world to receive medical care. We are truly blessed with the most impressive collection of compassionate, intelligent, and dedicated nurses, doctors, and public health experts. And from a public health perspective, as you may know, we have a remarkable history to celebrate. We were the first health department in America, under the leadership of Commissioner Paul Revere, to develop innovative early public information campaigns against cholera. The first place in America to successfully vaccinate and prevent the spread of smallpox in 1800. And the first passage of US law mandating vaccination of school-aged children in 1855. That tradition continues today. And because of smart policymaking, from expanding insurance coverage to the first in the nation community clinical linkage, the Prevention and Wellness Trust Fund, we have ensured that our Commonwealth has consistently ranked among the healthiest states in America. That's a history we should be proud of and brag about. But lost in that remarkable narrative are the often invisible pockets of people who, in a very real way, live in a different Massachusetts. From birth to death, the circumstances of an individual's life drastically impacts their health. Infant mortality rates are increased along socioeconomic and racial lines, and mortality rates are linked to zip code more than any other single factor. Simply, we as a state and a nation, we can and we must do better. Let me be clear. The biggest public health risk facing our society today are endemic health disparities. These disparities threaten the physical health and economic futures of our neighbors, street corners, and communities. The neighborhood you were born in, the school you go to, your parents' health. All of these things directly and dramatically influence whether you develop asthma, diabetes, heart disease, or die young. This public health epidemic will test every ability of our collective selves to respond as medical and public health professionals, but also as brothers, sisters, parents, and neighbors. If you remember one thing from today, let it be this. Endemic health disparities are our biggest public health risk, and will remain so until we, as public health professionals, address them head on. Standing here in front of you, the next generation of public health change agents, I believe with all of my heart and mind that the solution to this problem lies right here in the room with you. My personal interest in working with the urban poor and vulnerable began with a global outlook. A very specific exposure to roadside poverty gave me an early awareness. On my walks to the vegetable market in New Delhi, India, as a child visiting, I was struck by the range of human experience. One man in particular has always stayed in my head. I passed him one day, older, very frail, and obviously medically ill, living on the side of the road. When we passed by the next day, he had a sheet over his head. What stood out to me at that moment as a young teen was not just his death, but the lack of reaction of those of us walking by. At the time, I didn't realize it, but this would become a burning question for me. Rather than pass someone by who is dying on the street, what can be done to stop and help? But the more important question for us as public health professionals is one that took me a little longer to reach. And that question is, what can be done so that that person or their children never end up on that roadside to begin with? And that leads me to my first piece of advice. Be open to the unexpected turns that will come, and know yourself so that you can follow your instincts. Everyone's burning question will come in different ways and at different times, and evolve uniquely, but it might just become your guiding force, as it did for me. The image of that man on the side of the road stayed with me as I started school here at BU. It was as a student here that I met a nurse, Anna Bissonette. She was establishing a novel program to build housing for homeless elders. To me, the thought of 70 and 80-year-olds living on the streets and in shelters in Boston seemed implausible. So I jumped in and began helping in the small ways that college students can, helping to fill out surveys and meeting the individuals who were recipients of this housing. In essence, I was beginning to develop a fundamental understanding of the social determinants of health before I even began to learn about them formally. And as I heard about the struggles these individuals endured to try and keep themselves healthy, I became angered by the unfairness. I was reminded of the quote attributed to MLK, "Of all the forms of inequity, injustice in healthcare is the most shocking and inhumane." I propose that a fundamental belief in fairness and an understanding of those MLK words is what drives a number of us in this room to public health today. But what to do with this understanding? My second piece of advice is to jump in. If something speaks to you loudly, jump in. You may fall and you'll probably fail. It's a normal part of life. But if you always remain focused on why you're doing the work in front of you, what drives you, what moves you, you'll be able to get up again. What makes you angry? My understanding of disparities grew as I entered medical school and became a physician. One patient I remember fondly, I'll call him John. He was well known on the medical surface as the difficult homeless guy who was a frequent flyer. John had diabetes and spent a lot of time in the hospitals, but his interactions with the medical system were challenging at best. We knew exactly what the pathophysiology of his disease was and the medications he needed. We had less capacity to answer the questions about where he should store his insulin while sleeping under the bridge, or how to avoid the irregular meals and unsafe sleeping conditions. As a student, that was deeply unsettling. It still unsettles me today. And you know that circumstances of someone's life directly impacts their personal health. For example, people who score highly on a survey measuring childhood trauma have triple the lifetime risk of lung cancer and 3.5 times the risk of heart disease. So I argue today that a powerful shift must occur from bedside medicine to the halls of bureaucracy. We must address health issues with disparities and their causes at the root of care at all times. All of us who play any role in health fields must routinely approach situations like this asking, what caused this issue? What are the social determinants, and how can we treat those? For example, for John, underlying the diagnoses and multiple hospital visits lie the social determinants of his health, including abject poverty, unsafe living conditions, and food insecurity. So to move from roadside to the bedside to the broader halls of our healthcare systems, like community health centers, hospitals, and clinics, how can they address health disparities? I want us to think about our communities right here in Boston, but around the country as well. For example, in Chicago, just 7 subway stops translates into a difference of 16 years life expectancy. And as the events of Baltimore are still fresh in our minds, the Baltimore Health Department reported that there are neighborhood differences in mortality rates of up to 44% and life expectancy differences of over 7 years in neighboring communities. When you cross this stage and walk out of here today, whether you are a researcher, an analyst, program designer, or educator, addressing these issues is a collective effort. We need to be activists who ensure the value of health and are actively engaged in policy discussions at all levels. What is your burning question? And how will your work get us all closer to the creative solutions that we need? So my third and final piece of advice to you is when you are given the podium, speak for those who do not have a voice. If given the opportunity to lead, take the opportunity in order to shine a spotlight on your burning cause. To adopt the words of author David McCullough, you climb a mountain not to be seen, but to get a better view of the world. And as this is my opportunity to use the podium for just another few minutes, let me return to what I said earlier, that disparities remain our biggest public health risk. So how do we address them? This brings me to my current work at the Department of Public Health. DPH's mission is to promote wellness and health equity for all people in the Commonwealth of Massachusetts. We need to think about health in all policies. What are the conditions that help keep people healthy? How do we move forward? As a state, I believe that we must ensure that vulnerable populations receive better integrated and destigmatized care throughout the continuum of life. My primary priority as commissioner is to bring a real focus to identifying, triaging, and treating health disparities, which remain a real barrier to achieving true, equitable, and accessible health care for all. Massachusetts has the capacity to be a leader in innovative, outcome-focused public health based on data, data-driven approaches in the name of eradicating disparities. At DPH, we are advancing data collection and reporting to better identify and document populations experiencing disparities, promoting promising programs that are solutions-driven. From bedside to the halls of bureaucracy, we need to focus our effort on this real but treatable problem. Owen Arthur, the former Prime Minister of Barbados, has said, "For he who has health has hope, and he who has hope has everything." In closing, I offer today that the opposite also holds true. Without dependable health, there is little hope for any individual or their family, because these challenges are generational, of social mobility, and of individual economic independence. Populations that do not have the basic opportunities for equitable health are left without the vital chance at equal overall opportunity that makes our country so great. Thank you sincerely for allowing me to share my story with you and to share some words of advice. I leave you with this final thought. Graduates, from this day forward, you have a choice to make. Choose action. Choose the difficult path. Choose selflessness. Choose courage. And choose hope. Identify the currents of injustice, harness that current, and power the change you believe in to reach a place of fairness and equity where zip codes don't matter. So get out of your own way and watch yourself soar. Fight for social justice. Be the voice of those who don't have one. You have the education, the mentorship, and now the skills. It's your time to take this podium. Thank you.